So now it is my really great pleasure to introduce our conference opening speaker, Loretta Ross. Audre Lorde's oft-quoted statement that there is no such thing as a single-issue struggle because we do not lead single-issue lives is especially applicable to the topic of today's talk, reproductive justice and human rights. As a co-founder of the Sister Song Women of Color Reproductive Justice Collective, Ms. Ross worked to create and then advocate for reproductive justice, the marriage of reproductive rights and social justice. The first framework not only to center women of color in conversations about reproductive freedom, but also to expand that conversation to include issues around fertility, parenting, safety, and liberation, and to place reproductive rights firmly in the framework of human rights. She is a visiting professor of practice in the School of Social Transformation at Arizona State University, teaching reproductive justice theory and practice and race and culture in the U.S. for the 2018-2019 academic year. She is a graduate of Agnes Scott College and holds an honorary doctorate of civil law degree awarded in 2003 from Arcadia University and a second honorary doctorate degree awarded from Smith College in 2013. Ms. Ross has countless accomplishments in her nearly 5-decade history of social justice activism. Ms. Ross was the founder and executive director of the National Center for Human Rights Education in Atlanta, Georgia. Before that, she was the program research director at the Center for Democratic Renewal National Anti-Klan Network, where she led projects researching hate groups and working against all forms of bigotry with universities, schools, and community groups. She was one of the first African-American women to direct a rape crisis center in the 1970s, launching her career by pioneering work on violence against women. Sister Song's mission is to strengthen and amplify the collective voices of Indigenous women and women of color to achieve reproductive justice by eradicating reproductive oppression and securing human rights. Today we have the great honor of hearing from one of its founders and fiercest champions. Please join me in welcoming Loretta Ross. Yes, let's see if we can get it down here.
I'm old and fat, so I'm taking my privilege to sit down while I talk.
Okay.
I ask those that can't see me to move over so that you can see me. I mean, obviously, I'm no great shakes to look at, so if you don't want to see it, that's okay too. But I've lost my capacity for standing for long times. Well, actually, I can stand. It's just that I can't move after I stand. Thank you. Get that out of water. Yes. How y'all doing? I've had many, many, many trips to Wisconsin. I have gone to Madison, UW there. I started writing an essay called African American Women and Abortion at the University of Wisconsin-Madison, which has now has developed into a whole body of work, and that was in the early 1990s. But even before that, I've been to Wisconsin, to Janesville, to La Crosse. Unfortunately, my trips there were about fighting the Ku Klux Klan and the militia movement, because sometimes y'all have a slight problem. Can I just say it that way? But it is a wonderful state, and I think y'all are very privileged to live here and stuff. You have an amazing number of lakes and ducks. That seem to be, not everybody has that, right? I happen to live in Phoenix right now, and that arid place is not a joy to the eye. It's got a lot of benefits, but pretty scenery and lakes and ducks are not included. I think every kind of bird I see is probably a crow or a vulture. Anyway, I do need one thing. How much time do I have? Because I'm a professional talker and I can take up the rest of your day and actually make you enjoy it because I tell dirty jokes, but can someone give me a heads up? Okay. As I said, I don't want to just blow up your agenda because I, like running my mouth, and I'm very used to having penile-shaped objects in my face, so. Anyway. Did I promise to keep it clean? Nah. Someone was asking me, earlier before I got up here, how do I describe myself? I said, well, since I'm nearing 70 years old, I've given myself permission to claim the title as a slutty crone. And that's because, I came up in the 60s and the 70s, and even though I can't remember most of what I did, I know I had fun. So I actually think all the people who are now claiming their sexual freedom and their polyamory and stuff are like rushing to catch up to us who really did have fun. I am supposed to talk about reproductive justice today, so why don't I start with that? A lot of you have probably heard the term. 12 black women created the term in 1994 as a health care policy, because what was happening then was that First Lady Hillary Clinton and the Democratic Party had decided that they were going to try to reform health care, but they thought that a strategy of omitting reproductive health care would enable them to slide it past the Republicans without opposition. How well do y'all think that worked? Not at all. Not only was it a flawed strategy, because unfortunately their opponents are not asleep. Though they can be rather mean, they're not asleep. But we 12 black women objected to the strategy because it was a very male-centered plan, because reproductive health care is the #1 driver of women to the doctor. So you're asking us in the women's movement to support a plan that omits reproductive health care. That doesn't make sense. And so we decided to do a full-page signature ad in the Washington Post, August 16th, 1994. You can look it up online, Black Women for Healthcare Reform, and basically say, this ain't gonna work. And in that process, we coined the term reproductive justice by splicing together reproductive rights and social justice, because we offered a critique that too many people, particularly those obsessed with the pro-choice, pro-life binary, start at the wrong place. They start with the pregnancy, when in fact, you have to start with what's going on in women's lives long before they become pregnant. Do they have access to health care? Are they living free of violence? Do they have educational and economic opportunities? Do they have housing issues? Do they have food insecurities? All of these things that y'all are dealing with, we called attention to as social justice issues. And if you're not paying attention to those social justice issues, you're not actually looking at how people make decisions. Because many women turned an unplanned pregnancy into a wanted pregnancy if she has her social justice issues taken care of. If she's not afraid of dropping out of school, if she's not afraid of getting beaten by her partner, if she does have housing security, food security, educational opportunities, it'll be an unplanned pregnancy becomes, yeah, I'm ready to be a mother. But many people, unfortunately, can even turn a planned pregnancy into an abortion if any of those other things are not right. You know, if you're afraid that you're not going to be able to take care of the child, if you're afraid that you don't have a bedroom to put the child in, or you'll get beaten if you tell your partner, what, you know, on and on and on. And so we created the reproductive justice framework to move upstream, to say you've got to pay attention to the human rights issues that are taking place in the woman's life long before that pregnancy test shows positive. Because that's the only thing that really makes sense to us. And we did so because we were black women talking about what we needed. Now, a lot of people mistakenly say that we created reproductive justice as a way to push back on the pro-choice, pro-life binary, and that's actually not true. If that had been our thinking, we would have had to center white women in our lens, and we didn't. We centered ourselves in the lens. And we said, wait a moment, we joined with the pro-choice movement to fight for the right not to have a child, you know, which of course includes birth control, abortion, abstinence if you can hold on, you know. Some people say it works, but I've never abstained from anything, so I can't prove that. But because we are black women, we have to fight equally as hard for the right to have the children that we want to have and resist all kinds of strategies of population control and the blaming of our fertility for everything that's wrong with America. You can find a way to blame it on black women's wounds. Paul Ryan is very famous for that. Anyway, y'all heard of him, right? And so we have to fight equally hard for the right to have children, the right to have our birth plans respected, the right to use midwives, doulas, to resist forced cesareans, all of those things we call birth justice as a part of reproductive justice. And then the third tenet is the right to raise our children once they're here in safe and healthy environments. What a novel idea that is. That children deserve safe schools, adequate nutrition programs, to live in neighborhoods that aren't poisoned by environmental toxins, to have potable water to drink. Oh my God, try raising a child in Flint, Michigan. You know, these kinds of issues. And so when you talk about the right to raise a child in safe and healthy environments, well, that brings you into conversation with everything that human beings do. Whether it's your tax policies that determine what are the quality schools in the neighborhood versus the underfunded ones, the school-to-prison pipeline, whether or not there's adequate transportation in the neighborhood. I mean, all of those things. And so reproductive justice ended up being a framework, a paradigm shift, as a matter of fact, that not only deals with the biological issues of reproduction, but the non-biological issues that affect this, giving birth and raising a child. And so it includes everything, which kind of confuses people because they say, well, if everything is in there, what do you focus on? And I'm saying, well, you focus on people's right to have the best conditions they can make to make the decisions that make the best sense for them. That's what we do. We don't tell people what their decisions should be. We're going to optimize the conditions under which they can make them. That is the best we can do. Now, not everybody's going to make the decisions we wish they could make, but you know, I'm constantly surrounded by people who make stupid decisions. I wish I could isolate them all on an island, but I don't have that power. But I do fight for their right to make the decisions that make sense for them, even if they're not the decisions I would make for myself. And so that's what reproductive justice is. You've got the elevator speech, the right to have a child, not to have a child, to parent your kids. Can't we all remember that? It ain't hard to remember. It's just hard as hell to achieve. And so that's what Sister Song, Women of Color Reproductive Justice Collective does. We fight to create those conditions by which people can achieve reproductive justice. And before I leave, I want to invite you to our next conference, which is going to be October 22nd through 24th. We have these conferences called Let's Talk About Sex, Baby, and it's going to be in Atlanta. And our scholarship application should be up in a few weeks. We give away about $100,000 worth of scholarships to make sure that young people have access to the conference, but the conference is open to everybody. We usually have over 1,000 people coming together to talk about reproductive justice, but the conference was born from our young people saying that there was nowhere they could go to have safe and healthy conversations about sex and sexuality. Because they're in a sex negative culture right now. At the same time, they're making claims for sexual positivity, some of which are a little overblown, but that's just me. I'm a different generation. You know, I never would fight for the right to wear 6-inch high heels. I couldn't wait to take them off. I mean, I haven't been in 6-inch high heels since my 20s, and that was 50 years ago, so. But they fight for different things. They're a different generation. They play the hand they were dealt, not the hand I was dealt. So I really want to invite y'all to come to Let's Talk About Sex. We have a lot of fun at that conference. It's the greatest gathering of reproductive health rights and justice people in the country, populated mostly by women of color, but not exclusively women of color, because we invite everybody to that conference. And one of the things that we're going to be focusing on in particular at this conference is the collision between reproductive justice and the Me Too movement. Because right now, our entire movement is being roiled by the changing cultural norms that now are redefining how people touch, relate to, deal with, have sex with, all of that stuff with each other. And we have to have a serious conversation about this, particularly those of us who are sexual assault and incest survivors like I am, because every bad date is not rape. And I say that as a survivor. So the whole concept, the definition of a survivor has been so widely expanded that we need to have a conversation about that. We really, really do. And so I think that will be front and center at our conference, because we have to stay together as a movement and not be broken apart because we're in flux about gender identity, appropriate behavior, sexual oppression, reproductive oppression, all this stuff. We can figure this stuff out, but we can't figure this out if we're too busy calling each other out, which is the title of my workshop after this, because we have real enemies out here. We have people who do not want us to enjoy sexual autonomy, reproductive freedom, or even healthy lives. And if we spend all of our rage on our problematic allies, we self-weaken ourselves for the real fight against authoritarianism and neo-fascism. And so I take this very seriously, even though I tell a lot of jokes about us being a strong movement. Now, reproductive justice, I've already said, is based on the Universal Declaration of Human Rights. And so this presentation would be incomplete if I didn't tell you what are human rights. Because most of us have an idea about human rights being the tortured prisoner in a jail overseas somewhere, and we're not quite sure how that applies to the United States. Well, of course, anytime we torture somebody, that is a human rights violation. There's no denying that. But we find that most of the American public is totally unfamiliar with the human rights framework. We did a survey excuse me, back in 1998 that revealed that only 7% of the American public had even heard of the Universal Declaration of Human Rights. So there's no human rights education taking place in our school system. And what does that result in? You can't fight for rights you don't know you have. So I'm not so sure if that neglect is accidental or intentional. Because I believe that it's intentional because, of course, if we knew what our human rights were, there'd be lawsuits all across America to protect them. So I'm going to go through the 8 categories of human rights protection really quickly. By the way, there are tons of YouTube videos of me talking about this stuff, none of which I've ever posted, because I don't know how to do that. My twat don't tweet, so I don't have the capacity. But young people put them up there for me, so if you want a more expansive presentation on this, just Google my name and YouTube will probably reveal some of them. If I'm wearing the same dress, it's because I have a limited wardrobe. Anyway, the first category of human rights I'm going to start with is civil rights, because that's the category as Americans we are most familiar with. The right to be free from discrimination, the equality rights. And there, of course, was an African-American civil rights movement that then led to an indigenous civil rights movement and an LGBT civil rights movement and a disability rights movement, on and on and on. The second category is called political human rights. These are rights that we are taught in a different way because they're mostly emanating from the Bill of Rights, like the right to vote, freedom of speech, things like that. Though we recently learned that we don't have the right to have our votes counted. And the Electoral College keeps delivering us candidates who are not the winners of the popular vote. So we've got a real diminishment of our political rights when somebody can win the majority of the votes and still not win an election. The next category is called economic human rights. Economic human rights are our right to have the economy managed in such a way that it meets our needs. What a novel idea that is. Right now, we have the economy managed in such a way that it only benefits Wall Street and the 1%. You know, we can bail out banks, but we can't bail out homeowners, you know? That kind of economic logic of neoliberalism that just confounds the rest of us. I haven't filed my taxes yet, but I think I'm about to be pissed off with that tax cut last year that only went upward, not downward. Economic human rights are routine violations in the logic of people somehow. Then there are social human rights. Social human rights are your rights to have your human needs taken care of. Isn't that a crazy idea? That people have the human right to health care, my God. Food, clothing, education, welfare, Social Security. Oh my God, what a radical idea. Our opponents call that socialism. We call it human rights. People have a human right to have their human needs attended to. And we all have the same human rights, but because of our own intersectional individual identities, we all need something different to protect them. For example, every child has a human right to an education, but a blind child might need her books in Braille. That's not special human rights, that's special needs that need to be attended to so that she can get to the same human rights. And every one of us has our own unique intersectional identity that determines what we need from human rights in order to have our rights protected. For example, when I went to college, my parents hadn't been to college, so they didn't know how to send a child to college. They didn't know anything about filling out those forms or any of that kind of stuff. And so I needed special attention from my guidance counselor in high school that perhaps she didn't give to the kids whose parents did know how to fill out that form. You know, that wasn't that I was treated specially. I was treated in a way that paid attention to my needs so that I could get the same access to a college education that other people have. And so don't believe the hype that when we talk about paying attention to people's special needs, we're somehow affording them special privileges or special rights. That's just common sense. We're all individuals starting at different places with different intersectional identities, and you have to pay attention to those identities in order to achieve justice. The fifth category is called cultural human rights. These are the human rights that are born out of the fact that we all believe different things and come from different cultures. I, unfortunately, only speak 2 languages, English and Ebonics. So I don't have a need for anything in Spanish, but every time you publish something in Spanish or Hmong or any of those other languages, you're actually defending people's cultural human rights, even though that you didn't know that's what you were doing. You were just making things accessible. It is your human right to worship as you want to have freedom of religion. And we think that is very important, but those of us in the women's movement also like to point out that freedom from religion is also a human right. I have the human right not to have your religion imposed on my body. And I really get frustrated with people who do those religious impositions, like pharmacists who refuse to fill prescriptions or hospitals that refuse to provide the full range of reproductive health services. And because I get so frustrated with that around a narrow religious view that they can't even get their own followers to obey. You know, Catholics use the same amount of birth control as non-Catholics. So if the Pope can't even get the Catholics' information, what are you doing in my bedroom? Because I've never been Catholic. I mean, that's a legitimate question. Why are you in my public policy trying to get me to follow your religious dictates? You know? But we don't argue that as a human rights violation because we get trapped in this whole thing about, well, I believe life begins here. I believe this. You can believe whatever you want to believe, but you've got to give me the freedom to not believe what you believe. You know? Otherwise, we're a theocracy, not a democracy. Yeah, so anyway, I could go on. The sixth category of human rights is called environmental human rights. We recognize that without a clean environment, without the right to potable water, non-GMO food, healthy food, climate change, all of those things, we're not going to be around to fight for our human rights much longer. You don't take care of the planet can't take care of us. And so we think environmental human rights are very important. Unfortunately, we have an administration that's into denial of environmental injustices. You know, think that every pipeline is a desirable pipeline, even if it goes through people's water tables. We should do offshore drilling because it allows people to make money regardless of the damage to the ocean, on and on and on and on. Everything is permissible if people can make money off of it. And that is the wrong value system. That is not a human rights-based value system. That's a transactional value system. You know, things are only worth what somebody's willing to pay for it, which, of course, when it's applied to life, shows how corrupt that system is. Then the seventh category is called developmental human rights, and that's probably the hardest to describe. But It's based on the right to develop one's own natural resources, so that people in what used to be called the third world, which is now called the global south, but at one point was called the developing world, which is why it was named Developmental Human Rights, made the anti-colonial claim that they had the right to develop their own oil and gas and diamond and uranium and plutonium resources without Western countries and Western companies coming in and taking them. And I would argue that most of the wars that take place in the world and all of the regimes that we seek to overthrow are because we want to take their natural resources. And that is so corrupt. That is so corrupt. We should have been so off of this oil-dependent economy so long. In the 70s, we got a heads up when we had those long gasoline lines and stuff like that, that an oil-dependent economy had a short shelf life. And yet too many people were making money off of oil, so they derailed all of our alternative energy campaigns to where now getting solar in your house costs so much money intentionally because somebody doesn't want to lose the profits. So developmental human rights are very important. The eighth category is called sexual human rights. And these are human rights demanded by the women's movement. We started claiming sexual human rights in the 1970s because we decided that it was a woman's right to decide if and when she had sex, if and when she had children, if and when she got married. And what's interesting about sexual human rights is that they were such an attractive package. Next thing we knew, the LGBT movement, particularly the trans movement, started glomming all over sexual human rights, which is fine, but I do have a problem with that. And the problem is this: you don't want to make the same mistake around claiming only one category of human rights that African Americans did around civil rights. You want to claim the full array of human rights, because sexual freedom means nothing if you're still poor, if you don't have housing, if you're getting discriminated against. And so those are the categories of human rights as they presently exist. But I don't want to give the impression that that's all there is, because since the 1990s, there's been bubbling up a recognition that the ninth category of human rights probably will be digital human rights. Because right now, we're quickly becoming a society that if you're not digitally connected, you're not going to be able to access education, health care, banking, all kinds of things in life. So the digital divide, by definition, will be a human rights violation. Those rural areas that don't have easy internet access will, by definition, have their human rights violated. And so we think that reproductive justice is a pathway towards achieving the full array of human rights. It's not just sexual rights. It's not just civil rights. It's not just social rights. It's all of those together. And that frightens people because we're now saying we want to join the rest of the global community that believes in human rights. And there are people who make a lot of money off of the denial of human rights in this country because bigotry and discrimination is unfortunately very profitable. And so we're going up against a tsunami of bigotry, hatred, misogyny. Y'all know the isms. I don't have to lay them out for you. But I'm really excited by the fact that we created reproductive justice. And even though it was created by African American women, it would be racist to assume that it only applies to African American women because it's based on the human rights framework. And what human being doesn't have human rights? And that assumption assumes a couple of things that bother me. First of all, it assumes that black women, as activists and theorists, can't create a theory that's universally applicable, which is kind of silly given how many of y'all now use the concept of intersectionality. Wasn't that created by a black woman? Then it also assumes that there is a racial divide in our movement, and there's tensions. Now, there is white supremacy in the movement, let's be clear. I'm not trying to deny that, but I'm not convinced that everybody who's white is a white supremacist, and I'm not convinced that every white supremacist is white. So, that's another false equivalence or a false binary that we have to figure out. And so it assumes a racial divide in the movement that is insurmountable, and I just don't buy that. I think we all have different ways of claiming our human rights, participating in this movement, and owning the possibility of living a human rights way, living out our human rights values. And so I think I'm probably running out of time. How am I doing? That was too far away for these bad ears to hear. I got 15 more minutes? And then questions? Go, y'all. Now make sure y'all keep me on point, because as I say, I talk, and I might start talking about Venus and Serena or something, so. But by the way, that's not such an unrelated comment. Let's think about someone as rich and famous and powerful as Serena Williams not getting adequate respect given to her knowledge of her own body when she gave birth. I mean, if Serena can't get reproductive justice in a hospital, what is there for the rest of us? When healthcare providers say, oh no, you're just imagining that embolism traveling through your body, even though you've had a history of embolisms in the past. I mean, our challenges are many. One of the things that I'm working with the University of Michigan on is reproductive justice healthcare training to be included in their medical school curriculum. And that is a very important project, but I have to honestly say they might regret inviting me to participate in it, because I think they issued the invitation with the expectation that I would come in and teach physicians how to be more culturally competent or culturally humble or whatever the new language around that, about serving others, which is necessary. I'm not devaluing that practice. But when you use reproductive justice as your framework, you go upstream. I am focusing on the dehumanization of the physicians in their medical training process. If you brutalize people to become a doctor, why do you think they're going to regain their humanity and compassion for others when they graduate with hundreds of thousands of dollars worth of debt and suddenly turn it on and become a reproductive justice competent physician? That's a stupid and impossible ask. I think the way physicians are trained violates their human rights. Other Western countries do not brutalize their doctors in their training. We're choosing to do so and acting like it's inevitable. And so when I challenge them with wanting to start with what they call patient-centered care, and I was like, yeah, there are a lot of people doing that. Let's talk about human rights violating training. They didn't necessarily want that one because that's raising into question what is seen as unmovable, the training of healthcare professionals in a human rights violating way. They didn't want to hear that. And, the whole debt structure and why is college, why does everybody go to college have to enrich a bank? I don't get that relationship. I'm old enough to where when college was $200 a semester. I mean, really? $200 a semester at Howard University. We aren't talking about community college. So when they chose to change how college is financed and paid for, that was an intentional decision. They ended up screwing every generation basically after mine. And they don't have to make that decision. They chose to do so that banks and Wall Street could profiteer off of people's need and desire for education. It's kind of like, why do we have to pay $1 gazillion for insulin? I mean, what is going on here? We are trying, it's about profit. And so I think that when you use reproductive justice, you're going to be asking a whole lot of uncomfortable questions in quarters where people don't want those questions asked. Not because they're bad people, but because you are asking questions that cause them to challenge very internalized logics that are just about profits, that aren't about delivering the best services to people and protecting the human rights of the patients and the providers at the same time. And that, like I said, violating people's human rights is extremely profitable. So now people are going, well, you're threatening my job, you're threatening my this, you're threatening my that. Yeah, but you have to not see it as a threat to your job, but a protection of your human rights. And we have to rethink all of this. I think I'll start winding down by talking about reproductive futurism, because that's my favorite topic nowadays. What's up there for the future? And maybe I'm so leaning towards reproductive futurism because I've been an activist since the 70s, and I am real tired of us making the same old mistakes. I'm so ready for us to make new mistakes. Like, how many times can we keep circling around to brutalizing each other, not understanding, dealing with folks that don't know the difference between research and me-search? I mean, maybe I'm just getting tired of fighting the same battles I was fighting in the 70s. I want to fight new battles. And so one of the things that I believe, if you use a reproductive futurist strategy, is that we're going to have to develop a different philosophical foundation of what we mean. It's not just about individualism and my right to climb over your carcass to get what I want. It's about how we're in this collective human community together. I think the Jewish tradition has a wonderful statement of values that I was taught by one of my mentors. And that statement of values isn't do unto others like you'd have them do unto you, which is a great one. I was taught that in the Christian tradition. But it says, I can't be, my neighbor's material needs are my spiritual needs. What that basically means is that I can't be right with God if I am not right with my neighbors and my community. God will not accept me if I'm only for myself. That's a different philosophical foundation. Instead of just trying to figure out on your individual relationship with God, what about a collective caring for the community as a pathway of getting to God? It's a different philosophy. And so I think that we're going to have to go back to some of those ancient philosophies of Confucianism and Ubuntu and Judaism, some pre-colonial, pre-European philosophies to rest human rights on. Because we can do better, and we have done better in the past. It's just that once we decided that our whole philosophy would be based on pillage and plunder and exploitation that happened in the Iberian Peninsula in the 11th century, we've been on this one pathway. Let's screw others before they screw us. There actually were other ways of human beings being together. And we need to explore those. 5 minutes now? Okay. One of the things we use reproductive justice to determine is to explore whose bodies matter and why. Because obviously not all bodies are privileged in our society. Not all babies are wanted in our society. And we have to explore those the differentials values that we attach to babies' bodies. We're in a society where white babies are commodified and babies of color and indigenous babies are devalued. So we have to ask those questions. We're also in a period where we've got a small group of very determined people who have decided that democracy, one man, one vote, will no longer protect their privileges. So they're deconstructing democracy in plain sight, attacking the judiciary, the media, universities, everything. If you haven't read Nancy MacLean's book, Democracy in Chains, I totally invite you to read it. She's a historian at Duke University who's written an excellent expose of this 60-year campaign to rid our country of the belief that one man, one vote should be the way we govern. And of course, we need to understand that protecting democracy is not a spectator sport. It's something we all need to participate in. Now, we've never actually had a good democracy. I'm always constantly going up against people. One of the courses I teach is called White Supremacy in the Age of Trump, which is euphemized as race and culture in America in a red state, but that's a whole nother conversation. But anyway, one of the things that I'm constantly going up against is this belief is that somehow since the election of Trump, we've become worse as a country. We've somehow, done all these bad things. And I'm like, wait a moment. This is not Trump bringing in a new America. America's always been like this. It's just that certain parts of the population didn't recognize it, were insulated from it, and benefited from it. So there's a woke thing happening, but there ain't a fundamental change to America being constantly at war with everybody to protect its own privileges. And fortunately for me, every time I offer this course, I'm oversubscribed. I got a waiting list of white kids trying to get into these courses because they're finally learning information that has been denied to them all their lives, a way of living whiteness differently, so that you don't end up reinforcing white supremacy, but you actually participate in its deconstruction so that you can be all you can be and not just passively supporting an oppressive system while throwing your skirt over your head and saying, it's not me. And so let me close. I think it's really important for us to come up with a way of building a reproductive justice movement based on human rights that includes everybody. I like to think that we're the women's rights wing of the human rights movement, working with the environmental justice wing of the human rights movement and the anti-racist wing of the human rights movement. We don't all have to work on everything at the same time, but we have to make sure that we don't do women's rights work in a racist way and cause a contradiction for our allies. We can't do work against transphobia in a sexist way and cause contradictions for our movement, nor can we be transphobic as women's rights activists. I mean, we've got to figure out how to build movement, believing in different things, but agreeing to be together so that we can protect ourselves from the global rise of fascism. Thank y'all for coming out and listening to me. Thank you. Thank y'all. You don't have to do a standing ovation. It wasn't that great.
Well, I think that we do have time for questions, and thank you. That was outstanding. And feeling sad, and I don't know, that was just amazing. So there are microphones there. If you have a question, please go to a microphone, and we have about 15 minutes for questions. So.
You may have to point them out to me because I've lost my glasses in my hotel room. Oh. So right now, the audience is kind of like a blur.
Is this on? Can you hear me? Thank you so much for your work and for your speech today. I come from a county where we have one of the highest disproportionate infant mortality rates compared to the state. And that was published in the Race to Equity report. But it's also a very white liberal county. And so there are lots of committees and committees to address the situation. And there's lots of money going towards focus groups, but the focus groups keep saying the same thing, and they are a demand for human rights and a demand for being heard. And I'm just curious, what do you say to a majority white committee that's being created to address disparities, but really is just, there are just so many, and I don't know how to push them towards more action. And so I'm just curious to know, what advice do you have for some of those committees and to kind of move a little bit past the talking part?
I wish we had easy answers, but strides are being made in communities that have declared themselves human rights cities, and that's causing them to look at all of those areas like housing, taxation, healthcare, education, prisons, all of those things that intersect in our bodies. And what that creates is a possibility of making changes across a wide spectrum of indicators, as opposed to only focusing in and narrowing down to one or two. Some cities actually issue human rights report cards, where every year on Human Rights Day, December 10th, they do an assessment, an evaluation of progress that they're making on those indicators. How many more people have access to health care, or to have they been able to eliminate a food desert, on and on and on. They create their own benchmarks for evaluation so that they can measure progress. Unfortunately, we're having to do at the municipal level what our government will not do at the state or federal level. Then that's not the way it's supposed to be, but we can't just sit into passive inaction just because people protect profits. And so that's one possible strategy to not only use the human rights framework, but apply it to municipal decision making, which would be one way of creating change, but it has to start with human rights education. I said that at the outset. People have to first define what they're fighting for, not just what they're fighting against. Because a negative definition, by definition, needs an enemy. Where we want to talk about the world we want to create and the pathway towards achieving it. So that's one strategy. I invite you to contact the U.S. Human Rights Network, which is in Atlanta. I don't know their phone number off the top of my head, but they've got hundreds of human rights-based organizations in their network based here in the United States. And it's led by people of color, women of color. And they are coming up with some really creative strategies for bringing human rights home to communities in the U.S. Why don't, if you have questions, line up so that we don't lose time with people walking to the mics.
Thank you for sharing with us your decades worth of experience working on these issues. My question is, in the room we have a lot of perinatal care professionals that work in various fields. We have a lot of nurses and physicians and social workers, and they all interact with people who are at different places in their perinatal care. And I think you did a wonderful job of helping us think about the systems and the things that need to be changed. And I was wondering if, in sharing this and working with other groups, if you had any suggestions about, for people who wanted to take those kind of larger thoughts around systems back to their smaller settings, if there's any recommendations you have for things that they could focus on or conversations they could start with their colleagues.
I offered as my workshop calling in the calling out culture because I'm focusing less on the what than the how. Whenever you want to make change, you cannot start by devaluing or disrespecting the people you want to bring along in that change. I don't care what you're working on, how, it just does not work. And so what I'm hoping that we can learn better to do is to create change while respecting each other's human rights and right to hold different opinions. Because when everybody has like different ideas and they move in the same direction of change, that's a movement. But when people have one idea and they move in the same direction, that's a cult. And many times we use cult-like behaviors calling itself social change, because we put a tremendous pressure on people agreeing with us and kicking out of the family anybody who doesn't agree with us, because we're the thought police. Like, you can't think that, because that's not politically correct. You know what I'm talking about. I don't have to describe that behavior. And so in any formation, there's going to be a left, a center, and a right. I mean, whether it's a church, a hospital, a nonprofit organization, that people are going to be at different places along a continuum. And so I find that as a community organizer, we have to be strategic with each one of those places. We can't assume that the people who most agree with us, let's say the 90%ers, require the same strategy as someone who's a 25%er, who only 25% agreement, and that 25% may be Gravity Works and we're Americans. I mean, which is kind of a low bar, but even that bar is getting contested. There are flat earth people out here. So, and science doesn't matter, and science is just a matter of opinion to some people. I want to invite them to jump out of a window and see what happens, but but that's not a human rights thing to say. But anyway, and so I would invite people to look at organizing strategies, effective organizing strategies, rather than trying to create pressure on people to all line up in formation and believe any one thing. You have to have space for disagreement, for dialogue, for debate, for people to make up their own minds and keep holding that container for that diversity of opinion and thought, rather than trying to shape people to fit into your container. And that's just organizing. That's just organizing. Many people who go through academic training don't get community organizing training at the same time. And so consult with those of us whose job it is to line up a herd of cats.
Thank you.
Hello, I'm Dr. Zapata, and thank you for all the wonderful work that you've been doing. I've been following you. I heard you speak at Black Women's Wellness Day with Lisa a few years ago.
Oh yeah, Lisa Claire,
yeah.
Amazing resource
Yes.
here.
So one of my questions is, what advice would you give if you could go back many years when you were first starting in your movement? What advice would you give yourself, or would you give to the younger generation who are looking to follow in your footsteps in reproductive justice? Just any advice, if you could go back and encourage yourself or tell yourself, or advice for people who are passionate, energetic, ready to carry on the mission. Because one thing that I found already is that I'm so passionate about this, have been working on a lot of issues surrounding this and combating inequities. But when you think about fighting for reproductive justice for your community, the toll that it takes on your own body and yourself, and you're compromising your own reproductive justice in fighting for others. So how do you kind of balance that out?
Well, I entered social justice work at 15. I became pregnant at 14 through incest, and that is not the best pathway for becoming a mother. But I chose to keep my son, and so I went from a pregnant teenager to a mother, like with just that decision. And back in the 60s, it was very common to expel girls for having been pregnant. And so my first social justice fight was my fight for the right to return to my high school. Fortunately, my parents were totally behind me, and we ended up suing the school system and changing policy in that school system so they no longer could expel girls. But at 15, I was insufferable me. And I probably am still insufferable me, but I've tried to tamp it down in the 50 years since then. And let's be clear, this was before the first rape crisis center was founded in 1972, so I had a lot of PTSD that was unaddressed. I became an abuser of drugs through self-medication. I did a lot of messed up stuff while I was doing social justice work. And I spent a lot of time hiding the messed up stuff I was doing because I didn't think that I could, I didn't know how to handle any of that stuff. And fortunately, I developed my Black feminist consciousness in Washington, D.C. around a lot of elder Black women who saw things in me I couldn't even see in myself at the time. And even though they didn't like me because I had these baby dreads growing out, and that was like, oh, what is wrong with her hair? But still, they knew that I had potential in the world. And so they guided me often with, just their truths, but they never gave up on me. And so even though I was arrogant and insufferable towards them, they didn't give up on me. And so by the time I was 27, I was clean. I was able to lead a rape crisis center. I was able to do a lot of other things and commit myself to social justice work forever. But the thing that best worked for me was the intergenerational work. I will never, ever discount that, because my age group, we were a cannibalistic group, calling each other out for, you don't think this, you're not this, you're not this, you're doing the radical work and you're doing the reform work and you believe this and you believe that. I mean, we were very cannibalistic against each other in a way. And so it took elders to help us see past what divided us into what helped us stay united. And so if I could talk to 14-year-old Loretta, I would probably have a different conversation with my mother, because she believed in keeping her children sexually and racially naive, and that made us vulnerable. And that was because of her own internalized incest story. She had been abused from age 8 to 16. So she had no process herself. And this took place in the 30s. So she had no process herself for actually protecting her daughters. And she didn't even tell me this until I was in my 30s. And I looked at my mom, I was like, Mom, do you realize how useful this would have been to me at 14? You know, but that's how long it took her to own her own story. And so I would probably tell my 14-year-old self, sexual naivete, racial naivete, class naivete is not the good way to parent children, because you make them so vulnerable in a misguided attempt to keep them innocent and protected. But you really can't protect people from the world. The world intrudes whether or not you cocoon them or not. I would, again, teach myself to respect elders better. I mean, you don't have to listen to everything an elder does, because like I said, we have no idea of the challenges of different generations, but we do understand the challenges our generation faced, probably better than any new generation will. I was always a well-read child, because I was on the debate team in my high school. That would be the other thing. There were so many opportunities afforded me educationally that just don't exist anymore. When I was in middle school, it was obligatory to learn typing and public speaking. Guess how useful that would be right now? I teach kids who went to $50,000 a year private schools who can't compose a coherent sentence in college, who swallow their voices every time they got to speak up and pretend that I'm supposed to be able to hear them. Yet I'm like, you want to practice human rights and defend the vulnerable, but you can't even defend yourself with your own voice? I mean, there's just so many missing competencies now in the deconstruction of what's called education that's affecting public, private, and homeschooled people. And so we have to turn all of that around. And those are the kinds of things I tell my 15-year-old self. But basically, I tell myself, get the hell over yourself. Because, I mean, I was smart with a lot of book sense, but not a lot of common sense. And so I'm still in the process of learning tact. I'm still in the process of not feeling that imposter syndrome. You know, there's still things I'm still learning and stuff. So those are the kinds of things I tell my younger self. But I also tell my younger self that things are always getting better, even though they look a lot worse. Because when I was from 15 to 19, I was not only so self-destructive, but I was suicidal. And it was only when I got into clinical therapy that I was able to keep myself present enough to learn healing strategies. When I was doing anti-rape work, I was telling everybody else to go to a therapist, but I hadn't gone to one myself and stuff. And so I was committing, I guess, Munchausen by movement. Because I was expecting the movement to heal me when I wasn't taking charge of healing myself. So those are some of the things I would tell the younger me. Thanks for that question. That's a unique question. And thank y'all for letting me talk.
So I think, unless there's any other questions, I think I'd just like to thank Loretta Ross again, and thank you.